Aviation medicine. Aviation medicine, also called flight medicine or aerospace medicine, is a preventative or occupational medicine in which the patient subjects are pilots, air crews, or persons involved in space flight. The specialty strives to treat or prevent conditions to which air crews are particularly susceptible, applies medical knowledge to the human factors in aviation, and is thus a critical component of aviation safety. A military practitioner of aviation medicine may be called a flight surgeon, and a civilian practitioner is an aviation medical examiner. Very interesting. Broadly defined, the subdiscipline endeavors to discover and prevent various adverse psychological responses to hostile biological and physical stresses encountered in the aerospace environment. Problems range from life support measures for astronauts to recognizing an ear block in an infant traveling on an airliner with elevated cabin pressure altitude. Aeromedical certification of pilots, aircrew, and patients is also part of aviation medicine. A final subdivision is the aeromedical transportation specialty. These military and civilian specialists are concerned with protecting aircrew and patients who are transported by air evac aircraft, helicopters, or fixed-wing airplanes. Atmospheric physics potentially affect all air travelers regardless of the aircraft, as humans ascend through the first 9,100 to 12,300 meters, 30,000 to 40,000 feet. Temperature decreases linearly at an average rate of 2 degrees Celsius, 3.6 degrees Fahrenheit per 305 meters, 1,000 feet. If sea level temperature is 16 degrees, the outside air temperature is approximately negative 57 degrees Celsius or negative 70 degrees Fahrenheit. At 10,700 meters, 35,000 feet, pressure and humidity also decline, and aircrew are exposed to radiation, vibration, and acceleration forces. The latter are also known as G-forces. Aircraft life support systems such as oxygen, heat, and pressurization are the first line of defense against most of the hostile aerospace environment. Higher performance aircraft will provide more sophisticated life support equipment such as G suits to help the body resist acceleration and pressure, breathing apparatus or ejection seats or other escape equipment. Every factor contributing to a safe flight has a failure rate. The crew of an aircraft is no different. Aviation medicine aims to keep this rate in the humans involved equal to or below a specific risk level. The standard of risk is also applied to airframe avionics and systems associated with flights. Aeromedical examinations aim at screening for elevation and risk of sudden incapacitation, such as a tendency towards myocardial infarction, heart attacks, epilepsy, or the presence of metabolic conditions, diabetes, etc., which may lead to hazardous condition at altitude. The goal of the aeromedical examination is to protect the life and health of pilots and passengers by making reasonable medical assurance that an individual is fit to fly. Other screen conditions such as color blindness can prevent a person from flying because of an inability to perform a function that is necessary. In this case, to tell green from red, these specialized medical exams consist of physical examinations performed by an aviation medical examiner or a military flight surgeon, doctors trained to screen potential aircrew for identifiable medical conditions that could lead to problems while performing airborne duties. In addition, this unique population of aircrews is a high-risk group for several diseases and harmful conditions due to irregular work shifts with irregular sleeping and irregular meals, usually carbonated drinks with high-energy snacks and work-related stress. So read about the 1% Rule, Aviation Medicine, Aerospace Medical Association, American Board of Preventative Medicine, American Osteopathic Board of Preventative Medicine, Civil Aerospace Medical Institute, Museum of Aerospace Medicine. Read all about space medicine, read all about aviation medicine.